Autism Spectrum Disorder, or ASD. So, what is it? ASD is a neurodevelopmental disorder defined by the core symptom domains. Remember, it's a spectrum, meaning the presentation can vary widely from person to person. First, let's talk about Domain 1, persistent deficits in social communication and interaction. This includes issues with social-emotional reciprocity, like not engaging in back-and-forth conversation or sharing interest. You'll also see poor nonverbal communication, like reduced eye contact or unusual body language. Finally, these individuals often struggle with developing and maintaining relationships. Domain 2 is all about restricted, repetitive patterns of behavior, interests, or activities. You need at least 2 of these for a diagnosis. Think stereotyped movements like hand flapping or lining up toys. There's also a strong insistence on sameness, where small changes can cause extreme distress. Another hallmark is highly restricted, fixated interests that are abnormal in their intensity, like an obsession with trained schedules. Lastly, watch for hyper or hyporeactivity to sensory input, like being indifferent to pain or having an extreme aversion to certain sounds or textures. Remember, for ASD, symptoms must be present in the early developmental period, typically the first 2 years. If social withdrawal or repetitive behaviors suddenly appear in an older child, you must consider other diagnoses. First, rule out hearing impairment. A child who doesn't respond to their name might simply be unable to hear you. A hearing test is essential. Also, consider Rett syndrome. Especially in a female patient, look for a period of normal development, followed by a regression and loss of purposeful hand skills. Finally, distinguish it from social communication disorder, where a patient has social deficits but lacks the restricted, repetitive behaviors required for an ASD diagnosis. Consider ASD when hearing terms like lines up toys, distressed by changes in routine, flaps hands, and intense interest in one topic. Early signs to look for include a lack of pointing to share interest by 12 to 18 months, not responding to their name, and any regression in language or social skills. Keep in mind that ASD is often comorbid with conditions like intellectual disability, ADHD, and anxiety. So, how is it managed? The diagnosis is clinical, based on DSM-5 criteria, often after universal screening at 18 and 24-month well-child visits. The absolute cornerstone of management is behavioral and educational intervention. This includes things like applied behavior analysis, or ABA, speech therapy, and individualized education programs in school. Medications like risperidone or aripiprazole don't treat the core symptoms. They're only used for associated issues like irritability or aggression. To recap, know the 2 core domains: social deficits and repetitive behaviors. And remember, the best initial management is always behavioral and educational intervention. Keep grinding.